BANS committee essentially is a multi-disciplinary committee of BAPEN, and it reflects that multidisciplinary background to the association. So there are representations from dietitians, specialist nurses, pharmacists, patients, and from clinical medical staff. So BANS is essentially a registry of patients in an anonymised way who are on artificial feeding at home, so home artificial nutrition support, be it enteral tube feeding or parenteral feeding, and that covers both adult and paediatric practice. Well, BAPEN historically was involved with registries for parenteral nutrition and enteral feeding, which came out of Salford. There was a parenteral feeding register in Salford, and the PEN group, the specialist dietitians group, had a home enteral tube feeding register. And both of those activities started to increase in volume, and it seemed right that BAPEN brought together those two activities and have really hosted that registry since 1996. Well, the BANS registry is really unique in the world in terms of a register of patient and clinical activity. So the benefits to healthcare professionals are really essentially having a log of that clinical activity, so we can map and follow trends in patients, the type of feeding they receive, their underlying diagnoses, and that has changed over the years and over time, and that's useful for, at a local level, for individual teams planning their services. They can to a certain extent benchmark their service against other national colleagues, but nationally it's really important for policymakers as well that we know the volume of activity that's been undertaken in UK hospitals. So there's lots of work going on at the moment to make BANS fit for 2015 and beyond, and essentially there are three main programmes of work. One is to support the adult intestinal failure registry, and that's a big step forward in terms of the type of data that we collect in the UK, specifically looking at clinical outcomes and benchmarking individual intestinal failure centres. We've done a lot of work with our paediatric colleagues to develop a paediatric intestinal failure registry, and that is launching very soon. And finally, we're now moving forward to work with our colleagues in the PEN group to develop an enhanced reporting tool for home enteral tube feeding, with our aim that we will have outcome data for the HETF community, which historically we haven't had. So a clinician or anyone in a hospital setting, or indeed a community setting, actually can contact us directly to become involved with BANS. It's very easy to register reporters on our electronic reporting tool. Essentially they need to have an nhs.net email address, and then the rest is very simple from there.